All right, welcome to the Explainer. Today we're jumping right into a really important group of high-stakes medications. We're talking about drugs that have the power to do amazing things, but, they also come with some serious risks. So we're going to be your guide and create a simple, clear safety framework.
So, what is the common thread here? Well, all three involve the body's super powerful defense systems going into overdrive. And managing them? It's all about telling those systems to just calm down a bit. And today, we're digging into the high stakes meds that do exactly that. Okay, here's our game plan. We're going to start with the drugs that make organ transplants possible, then move on to some heavy hitting anti inflammatories. After that, we'll tackle those everyday allergy meds, look at respiratory treatments, and then pull it all together with a safety checklist you won't want to forget.
Okay, first up, the medications that make miracles, like organ transplants, a reality. We're going to focus on cyclosporine, a drug that basically has to convince the body to accept a brand new organ and not fight it off.
Look, if there's one thing to take away about these drugs for a transplant patient, it's this. This isn't a short-term thing. Taking these meds is a lifelong commitment. It's a daily promise you make to protect that new organ. So check this out. The two biggest worries with cyclosporine are damage to the kidneys and the liver. Think of this table as your safety roadmap. It shows you exactly which lab values you need to keep a close eye on to catch any trouble early. This seems kind of random, right? A piece of fruit? But this is so important. Grapefruit juice can actually stop the body from breaking down cyclosporine, causing levels to build up to a toxic point. This is absolutely critical for patients to know. All right, let's switch gears to another class of seriously powerful drugs, glucocorticoids. Think of these guys as the special forces of anti-inflammatory meds. They're called in for the really tough fights, like severe asthma or autoimmune diseases. And this slide just lays it all out perfectly. If an NSAID like ibuprofen is like tossing a bucket of water on a small fire, a glucocorticoid like prednisone is the whole fire department showing up with a giant hose. It's on a whole other level. Okay, but there's got to be a catch, right? With that much power, there's always a flip side. And the catch here is a pretty long list of serious side effects that can pop up with long-term use. And wow, it is a sobering list. We're talking about a whole cascade of potential problems, from your bones getting brittle and a higher risk of infection to your body's own natural stress response system just quitting. Okay, listen up, because this is probably the single most important rule in this whole explainer. Your body gets lazy and stops making its own stress hormones when you're on these long-term. If you stop suddenly, it can trigger a life-threatening crisis. You have to wean off them, slowly. Okay, so we've talked about tamping down the whole immune system. Now let's talk about managing one of its most common overreactions, allergies. We're getting into antihistamines, drugs so common you might just underestimate their power and their risks. So how do they work? It's actually pretty simple. Imagine histamine is a key, and it's trying to unlock the door that starts an allergic reaction. Well, antihistamines basically come in and jam the lock. The key just can't get in. And the big difference between the old ones and the new ones, it's all about whether they make you want to take a nap. The older first-gen drugs can cross into your brain, and that's what makes you drowsy. The newer ones, they're designed to stay out of the brain, so they can tackle your allergies without the side trip to dreamland. All right, time for a little myth busting. People take these for colds all the time, but colds are caused by a virus. Allergies are a histamine reaction. Totally different things. An antihistamine might help dry you up a little, but it's not actually treating the cold itself. Whoa. Okay, this is a huge one. High alert, for sure. The antihistamine promethazine is incredibly dangerous to the tissue if given through an IV. If it leaks out of the vein, it can cause tissue death so bad it can lead to amputation. No joke. This is why it's a high alert medication. All right, let's take everything we've learned about inflammation and apply it to breathing. When you're dealing with stuff like asthma and COPD, getting the treatment right is like a strategy game. You need the right move at the right time. And for anyone with asthma, you absolutely have to know the difference here. Think of it this way. The rescue inhaler is your fire extinguisher. You use it when there's an active fire, an asthma attack. The maintenance inhaler is your sprinkler system, working 24/7 in the background to prevent a fire from ever starting. You'd be surprised how much medicine gets wasted just because of bad technique. Getting it right is a skill. If you don't follow the steps, the medicine ends up in your mouth instead of your lungs. Following these steps makes every single puff count. Okay, now with this drug, theophylline,
We're talking about walking a tightrope. It has this really narrow, sweet spot where it works. If you go too low, it does nothing. Too high, and it becomes toxic. That's why you have to keep checking those blood levels constantly. And here's a super important interaction you might not think of: smoking. Tobacco and marijuana actually make the body clear this drug out faster, so a smoker needs a higher dose. But here's the kicker: if they stop smoking, that same dose suddenly becomes toxic. It's a really delicate balancing act. Okay, so we've covered a lot of ground. Let's pull back for a second and tie it all together. Because across all these different meds, there are a few core safety rules that apply to pretty much all of them. So here it is, your go-to safety checklist. It really boils down to this: stay on top of the labs, make sure patients know what they're doing, understand the absolute do nots, like no live vaccines, and always remember to taper those steroids. And of course, make sure patients know to report any sign of infection right away. And that brings us to the end. These are incredibly powerful tools, but they absolutely demand our respect. So after all this, what's the one thing, the single most important action for patient safety? It's the one you take every single day: the commitment to keep learning and to be relentlessly vigilant. Because in the world of high-stakes medicine, knowledge isn't just power, it's protection.